what are the effects of pumpkin seeds on the cardiovascular system? So now we're going to roll up our sleeves. Now that you understand the cardiovascular system, now that we understand the constitutive elements, remember, a pumpkin seed is a food. It's not just a drug. It's got many different components in it. Now we're going to put this together to see why pumpkin seeds are good for heart health and how they do this. Well, as we mentioned earlier, pumpkin seeds have anti-hypertensive effect, which means they lower hypertension, anti-diabetic, and anti-arteriosclerotic, which means they stop plaque. Okay, they prevent plaque. So those are three very important cardiovascular benefits. Okay, so let's go into how this works. So if you remember, I said these are those active components. With Cytosol, we're able to figure out which of these components is really affecting the cardiovascular system. Let's understand some mechanisms. Mechanisms means the processes that can take place in your body. Now, so if you look at this mechanism, before I talk about pumpkin seeds, there is a chemical called angiotensinogen, which is right here on the top. And this is from the liver. And this gets converted to angiotensin 1, right? That's that arrow. So angiotensinogen gets converted to angiotensin 1 in the presence of renin, R-E-N-I-N, which comes from your kidneys, okay? So your kidneys put out this enzyme. So look at how complex of a system. The kidneys involved, the liver involved, the lungs involved, we'll see shortly, and the heart, okay? It's pretty wild. All systems involved in this. So renin gets put out by the kidneys. And what renin does is it makes angiotensinogen into angiotensin 1. Okay, that's the first step in this mechanism. Then ACE, which is called angiotensin converting enzyme. When the COVID thing was going on, you may have heard about this, the ACE receptors. But angiotensin converting enzyme, which is ACE, this converts angiotensin 1 to angiotensin 2. And where does ACE come from? Okay, ACE is converted by angiotensin 1 to 2 by angiotensin 1 converted in the lungs, okay? So this occurs in the lungs. Got it? This is why when COVID was taking place, you had problems with ACE. But when you're functioning properly, ACE converts angiotensin 1 to angiotensin 2. That's a second step. Now, in the blood vessels, which we discussed in the vasculature, angiotensin 2 right here initiates vasoconstriction via AT1, which is a receptor on the smooth muscle cells. This increases intracellular calcium, and this results in contraction of the smooth muscle cell. This is not a good thing, okay, because you don't want vasoconstriction. You don't want constriction of your blood vessels. What pumpkin seed extracts do is they block ACE. So pumpkin seed extracts inhibit ACE, thereby reversing vasoconstriction and hypertension effects. So bottom line is the pumpkin seed extracts, they block ACE, which allows the reversal of vasoconstriction and a reversal of hypertension, okay? Very, very powerful when you think about it, all right? So that's why pumpkin seeds are good for anti-hypertensive effect.
We'll return after these messages.
Millions of people suffer every day from painful discomfort and swelling, but most pain medications come with harsh side effects, and many alternative supplements have little scientific backing. That's why we at Cytosol created MV25. MV25 was formulated using the Cytosol Computational Systems Biology Platform, a technology for precision and personalized health invented by Dr.SHIVA during his doctoral research at MIT. This formulation is the result of computing trillions of potential combinations of biomolecular interactions derived from thousands of peer-reviewed scientific papers published across 4 decades by 68 research institutions to discover an optimal synergy of compounds that downregulate biomarkers of discomfort and normal swelling.
Hi, I'm Barbara Ann. My hands would cramp up so that I couldn't hold cards or knit or crochet, and they would go like that. And I'd have to use this when I played cards with my grandkids, and I started taking that MV25. After a bit, I was able to hold cards in my hand, Very, very little cramping, hardly at all anymore. MV25.
Hi, my name is Sandy. I'm a Taekwondo instructor. I tore my ACL during Taekwondo. I had a lot of pain and limited mobility. I've been taking the MV25 for about 6 months now. After the first week, I noticed a big difference. After the second week, almost literally no pain.
My name is Jeremy, and I suffer from a lower back problem. Hurt my back at work years ago, and I can go to the chiropractor, do all kinds of different things, and nothing seems to help. And I decided to try MV25. I didn't notice a difference immediately, but within a few days, the pain went away, and it stayed away. I've continued to take it, and even when I do things that I shouldn't do, it seems to go away a lot quicker than it ever did before.
MV25 is certified clean, 100% non-GMO, made in America, and GMP certified for good manufacturing practices. MV25 is Cytosol optimized, which means that this formula has been engineered to maximize benefits while minimizing toxicity based on current research curated by Cytosol. As the science advances, so will this formulation. This is our promise. Order online at mv25.life. Consult your doctor before taking any supplement or medication and use as directed. MV25.
And now back to your regularly scheduled program.
Now, anti-diabetic effect. So there is something very important in pumpkin seeds, okay? And what pumpkin seeds have is they have two compounds, vitamin E, which is over here, and they also have quercetin. And if you remember, during the COVID stuff, I recommended people supplement with quercetin. Now, endothelial dysfunction, this means when your endothelial cells are not working well. How is this caused? Well, this is caused by stress, oxidative stress. And oxidative stress is created by these two chemicals, superoxide and hydrogen peroxide. You see, oxide, oxidative stress in the endothelial cells. And so when you get superoxide over here, and you get hydrogen peroxide over here, I'm looking downstream here, these will cause endothelial dysfunction, which leads to diabetes. All right, so superoxide and hydrogen peroxide, you don't want this. This creates endothelial dysfunction leading to diabetes. However, compounds such as quercetin from pumpkin seeds upregulates NRF2. So the quercetin upregulates NRF2. You may want to do your research, a very important chemical for health. NRF2 results in the release of superoxide dismutase and catalase. These are two enzymes. Whenever you see ASE, that's an enzyme. These enzymes block superoxide and block hydrogen peroxide, which means they stop superoxide and hydrogen peroxide from causing endothelial dysfunction. But guess what vitamin E does? Vitamin E directly blocks superoxide. NRF2 is blocked. It's a two-step process by vitamin E in the pumpkin seeds directly blocks superoxide, which stops endothelial dysfunction. Okay? So bottom line, neutralizing oxidative stress promotes anti-diabetic effect. So pumpkin seeds, the vitamin E, and the quercetin help do that. So that's the second most powerful opportunity with taking pumpkin seeds, that they alleviate oxidative stress, which has an anti-diabetic effect. Now I want to talk about plaque, okay? You probably heard of arterial plaque, not a good thing. And again, the vitamin E and the quercetin in pumpkin seeds does two very important things. Let's look at that. Again, these are the biological systems mechanisms. So let's go down here. Here you have arterial sclerosis. Well, how is arterial sclerosis formed? It's when you have arterial plaque formation. Well, how does arterial plaque get formed? Well, it gets formed when you have OXLDL, okay? And the OXLDL sticks to the endothelial cell surface, and that initiates plaque formation that leads to the narrowing of the arteries, causing arterial sclerosis. Basically, you have your clean arteries, and you're basically putting down cement, and that causes plaque formation. And what's important to understand is, well, how does OXLDL get formed? Well, it gets formed by what they're calling the bad cholesterol, LDL, low-density lipoprotein. So if you hear it LDL, that means low-density lipoprotein, bad cholesterol. And the LDL creates OXLDL, which leads to plaque formation. And how does LDL become OXLDL? Well, there it is again, the superoxide. The superoxide, what it does, it leads to the conversion of LDL to OXLDL, which leads to plaque. And endothelial dysfunction, when you have endothelial dysfunction, you get superoxide, okay, which leads to LDL. But look what vitamin E and quercetin do. Vitamin E and quercetin from pumpkin seeds scavenge, which means eat up. They're like cleaning. They're like the janitors. They eat up all these free radicals, the superoxide, which is created when you have endothelial dysfunction. So endothelial dysfunction is what leads to arteriosclerosis, right? So when you have endothelial dysfunction, that's when you get arteriosclerosis because you create the superoxide. But the vitamin E and the quercetin in pumpkin seeds blocks the superoxide, so LDL doesn't get converted to OXLDL. And therefore, they lower the oxidative stress, which prevents the formation of OXLDL and the development of arteriosclerosis due to arterial plaque formation. There you go. So in this case, vitamin E and the pumpkin seeds have an anti-plaque formation.